Okay, guys, let's talk about the pandemic of 2020. So, we're doing current issues and trying to understand how this is related to government and history and how we've gotten to this point and how things are being handled. So, we're going to try to identify things that are factual and based on science and the science that we know at this point. We have to understand that the truth about the science of the coronavirus at this point may be we're not 100% accurate on everything. But we are also always in the process of learning, and science is based on consensus and making mistakes and uh, getting better data points and more evidence. So at this point, we're going to go over what we know. Right now, about 50,000 new cases of coronavirus are happening in the United States every single day. At its height, it's reached 70,000. Some of the hotspots have really been Florida, Texas, and California, which also makes sense because they do have higher populations, but we do see a disproportionately high number of infections in those areas. Now, let's get into the history. Actually, it's COVID-19, or also it's called SARS-CoV-2. We've already had outbreaks, and SARS have been around for quite a while. Now, SARS-CoV-2 originates from animals, probably bats, and was transmitted to other animals before crossing into humans at the Hunan wet, Hunan wet market in Wuhan City. So it does originate in humans, probably in the Wuhan area of China. Now, the way we know this is from phylogenetic analysis, which means we're studying like the genes and we can see how the disease has evolved and how we can trace it back to its present source. SARS has been around for a while. We've actually had we had several versions of SARS over the years, uh, and it's been SARS itself has been a rapidly mutating disease, and this version is different, however, than past versions. Now, SARS-CoV-2 is not the first coronavirus to cause outbreaks of respiratory infections in humans. 6 others have been identified so far, all believed to originate from animals. Most viruses and diseases do come from animals, and human contact with animals or eating animals. Probably one of the most famous outbreaks that has been controlled now, for the most part, was the HIV outbreak. And there was a lot of confusion, misunderstanding on how HIV came from animals. We do believe it comes from some kind of monkeys or animal uh, ape-like creatures. But what happened is, actually, when I was in school, at elementary school, they would tell us that they thought it was somebody being inappropriate with an animal, and that's not true. We now know that it's probably from what's called bush meat. So, in parts of Africa, they will eat bush meat, which they'll go hunting and they'll kill a monkey to eat it for food. And when they cut the meat, sometimes they'll use like machetes or dirty knives, and they might cut themselves. And by cutting themselves, they expose their blood to the blood of the monkey they were eating, and that's how they probably started the transmission of HIV, which makes it easier, more susceptible that you get infected by AIDS as well. But I remember it's been about 10 or 11 years, we had a SARS outbreak that was really the swine flu. It was really, really hard and deadly. Nowhere near to the point that we're in this pandemic right now. But I remember teaching years ago, and we had 2 teachers go out with swine flu, which was absolutely horrible. One of them went to the hospital for, I believe, 4 to 5 weeks, and they come back, and she was very young. She was actually like a first or second year teacher, and she was like really exercised and was in good shape. And you just don't know how our viruses are going to react to your immune system in your body until you are exposed to them. So we're going to talk about how we could not get exposed. Now, when we talk about a good source for information, and there's a lot of misinformation out there about COVID too. The first 2 places I would go, and the first place I would go is the WHO, the WHO, the World Health Organization. The reason is because the World Health Organization it's led by the United Nations, and it's a collaboration, a collective group of nation scientists coming together to reach some kind of consensus. So they're really good at putting data together, but also everybody, all these countries are sharing their information collaboratively to see if there's any patterns or if they're finding out any new information or seeing any trends in the behavior of this virus. That's why the WHO, the World Health Organization, is a phenomenal resource for valid information. When we further we get away from the WHO, the further the more likely we're going to get misinformation or mistakes in the information. CDC is a good one for the United States. One unfortunate thing is right now the United States is not working well with the WHO. Under our present government, they have cut off our information access and collaboration with the WHO. So we're still going to use them as a very valid source because they are. So as of now, this is climbing. There's about 280,000 new cases a day. There's 26 million confirmed cases, and there's almost a million deaths. Now those numbers will grow as this video, as soon as this video is done, and you guys watch it, those numbers will already grown. So we're going to look at real quick at what are the effects on different people in different ways. It affects people. We have a wide range of symptoms reported, from mild symptoms to severe symptoms. Okay, so how would somebody even think they have COVID-19? And that is a really good idea. So we're going to talk about what the real symptoms are versus maybe what people have heard. Okay, so symptoms may not appear for 2 to 14 days. So if somebody goes to an event and then they immediately think they have COVID-19, that's probably not accurate. It usually takes about 2 to 14 days for it to come through. And then you're contagious in that period as well. Highly contagious. Fever or chills are telltale signs, so that's why you see people, they scan your, they check your fever, or they check you for a fever before you come to a hospital or a school or any public places. That's always a good sign. Coughing, it's a respiratory infection, so definitely look out for people that are coughing, which is going to be confusing with allergy season because people like myself have allergies and we cough as well. Shortness of breath or difficulty breathing, again, it's respiratory, so you'll see those issues. Fatigue, feeling tired or exhausted is a good sign that something's going on. Muscle or body aches. A headache, not just a headache here or there, but lots of headaches could be a sign. New loss of taste or smell. This is a very strange one. It's very common. Like people can't taste their food. They can't smell because you think your smell dictates a lot of your taste as well. It helps with it. Sore throat, congestion or runny nose, nausea or vomiting are all signs that you could possibly have COVID-19. And what's pretty amazing about St. Louis City and County, we actually have free testing where people could just go up and get tested for free because the city and county governments are willing to pay for that, which I think is a phenomenal resource. So if you ever feel like maybe you should get tested, I would, or talk to your physician. The worst that could happen is you go and get tested and the answer is you're not sick, which is fantastic, but it's better to be safe or sorry than sorry and pass it on to other people. Diarrhea as well could be a sign of COVID.